Welcome, everybody, to another episode of the Watercooler. I am Pumla Schmidt, also known as Exchange Goddess, and I've got some friends along, and we've got a very, very good topic today: the Hunger Games of obtaining a COVID vaccine. All the aspects about it, the technology, the leadership, everything, and the frustration. And I've got Tyler Britton, Jeremiah Dooley, and Justin Deering with me today. Everybody, hi.
Hello.
How's everybody? Everybody alive?
Yeah.
My name's Jeremiah. I was going to say, my name's Jeremiah, and I will never get a vaccine because I live in North Carolina.
So where do we want to start? Because we have.
You're worried about 5G from Bill Gates and whatever for a second there. But this is going to go off the rails quick.
Yeah, but I mean, I work for Microsoft, so or Bill likes me and isn't going to put the microchip in. I mean, you could probably run with that either way. But yeah, I mean, I guess from a topic standpoint, like we have a little bit of everything wrapped up into vaccines, right? Like there's a little bit of tech. I mean, for those of you who are actually capable of qualifying for a vaccine, the process by which you get one has proven to be laughable at best. But then, I mean, every state has their different tiers and their different rollout schedules. And then you throw politics on top of it. And then you throw, stupidity on top of it. And it just feels like there's 27 layers of let's try to not make people die, which is so perfectly American at this point that it's ridiculous.
It's sad because the people that we're trying to help are the ones that are hurting the most. The vulnerable, the seniors. My God,
because that never happens in America, Pumala.
It's very. I think frustrating isn't even the word for it. Like, if I'm having trouble navigating through this complex system of obtaining a vaccine, my parents can't do it. Like, an 80-year-old not. No, it's ridiculous.
Yeah.
Like, why have we gotten to the point that we've made a life-saving thing, right? So difficult to do. And you made a good point, Jeremiah. Each state has their own different tiers and like, seriously, can we all get on the same page here? As you said, Tyler, it's all about getting shots in the arm, right?
No, it's not about getting shots in the arm. It's about putting money in people's pockets.
Yes.
And if you want to know why the New York process is so complex, and if you want to know why the North Carolina is so behind, and if you want to guess at what the bottom 10 states are as measured by total number of vaccinations given per 100,000 residents, like it's because there's no money in it. Like there's no process that ends up making rich people richer, and therefore why put any emphasis on it whatsoever?
Because we're saving lives.
Yeah.
But that's
they can
not cool.
spend more money.
Well, no. So that
they can live and get a job and spend money.
I think it's quintessentially American. It's I always think of the have you ever seen The Good Place? Mm-hmm. And when he talking about frozen yogurt, he's like, frozen yogurt is the most human thing. We take something really good and make it a little bit worse so we can have more of it. That to me, it's like, well, we could get as many vaccines out as quickly as possible. We can do these things, but if we do a little bit less, we can end up making a lot of money from it. So, one of the things that people we're in Pennsylvania, right? So it's the Wild Wild West. Like I said, other states have. My parents are in Jersey. They have a statewide central place you sign up. It gets all the My parents have gotten both of their doses by weeks ago, and in a pretty straightforward process. And Pennsylvania is just sort of like, hey, we have a list of websites of places that might have vaccines. So you should try each one of their individual things to get it. And it makes more sense when you realize. So the federal government is buying the shots from,
right,
but they are also paying to administer the shots. So Medicare, Medicaid pay, if you're on Medicare, Medicaid pay for I think it's like 16 for the first dose and 28 for the second. So if you're a pharmacy, you give those shots, you get that money. And then also most private insurances are reimbursing somewhere around $30 for vaccines per dose. So it's like, well, if the state or county sets up a mass vaccination event, that's not money in Walgreens or Rite Aid's pocket or your local pharmacy or whatever. So it's like, well, we're just going to like pass the doses out and just, let people figure it out on their own.
Here you go. Here's 14 million doses. You figure out what you need to do to get rid of those doses. And I've spent the last, several weeks trying to get appointments for people. I wake up at midnight, 3 a.m., 6 a.m., like whenever, right? And it's like, hello, why am I doing this? It's because there are seniors out there and non-tech savvy individuals that they are frustrated. I was reading in this Facebook group that I'm part of. There was a lady that was on the phone for 10 hours trying to get an appointment. 10 hours. Like,
but if you're super rich, if you're white and rich and you live in the right zip code, Florida will bring the vaccinations right to you.
Wait.
Oh, really?
There you go. So I don't look the right way, and I don't have enough money in my bank account, and I don't live in Florida. So,
Yeah. So
you
North
don't live in Florida though.
So North Carolina has their tiers, and I think every state they do it a little bit different, but it's the first responders, and it's like it kind of progresses through with the elderly and the people at super high risk. And North Carolina is interesting because they started way late. They didn't actually start vaccinating people until weeks and weeks after the rest of the country had started. And North Carolina is pretty kind of shockingly callous towards teachers in particular. Like they just don't care. So North Carolina is fun in that on Wednesday of this week, they opened up what they consider to be tier 3, which includes daycare and teachers as part of the group who can go get it. Now, interestingly, all of the teachers were told that they had to go back into the classroom or lose their jobs like a week and a half ago. So they actually, the state made the teacher, or the state made the teachers go back to school before they were ever even allowed to get the vaccines. So there were a huge group of teachers who were actually driving 6 hours round trip to Tennessee, where they could get shots because they were in the Tennessee group of teachers that's been able to get vaccines for, weeks and weeks at this point. The irony being that the only reason they were available in Tennessee is because so many of the Tennessee teachers were opting out of the vaccine because they didn't trust it.
That's another problem.
So North Carolina won't vaccinate teachers who go to a different state who use vaccinations that were made available to teachers who refused to take it just on I don't even know what grounds to call that, and are driving 6 hours round trip, like entire caravans of North Carolina teachers driving 6 hours round trip to get the same federal vaccine that was bought by the same government, just administered by the state next door. Like, it's just, there's no way that this is a healthy or reasonable process, and there's no fixing it.
It's, there's similar stories. There's people driving across Pennsylvania. Pennsylvania's a big state, right?
Yeah.
You got Philly, Pittsburgh. There's people driving from the Philly area to Pittsburgh to get a vaccine. That's 8 to 10 hours one way. And then they're driving home. Plus, then they're getting symptoms on the way to getting home. And it's like there's no reason we should be doing that. And I just feel like we could be doing, the tech is there to make this easier, the whole process less complex. And then from a political standpoint, why don't we all get on the same page from a phase 1A? Because I think everybody's definition of phase 1A is different. Because Pennsylvania phase 1A includes 65 and over just recently. They just included that. And 16 to whatever on above with underlying conditions, in addition to frontline workers and long-term living facilities. But North Carolina is different, right? Jersey's different.
Well, one of the crazy things about it too is first of all, it hurts your computer programming brain of so we have a set of definitions. So instead of being okay, we're going to move to 1B and 1B also includes this. This new one be we're going to redefine 1A. So I know people that have been oh, well, I'm not eligible. No, they changed the definition. They're oh wait, I didn't know that.
Yeah.
And then to make it even more interesting, I think it's 5 cities nationally that receive vaccines directly from the federal government, not through their state. So they can set up, and Philly's one of them, set up their own. So Pennsylvania has like one ABCD2, and then Philly has one ABCD2, and they're totally different definitions.
You look confused, Jeremiah. Like your face was like.
No, see, what I was going to say, like I was looking up to see what the specific tiers are in North Carolina, but it's hard for me at this point to separate out anything that happens in Pennsylvania from Tyler, who had the most amazing description of Pennsylvania that I've ever heard and that I've used every time anyone has mentioned Pennsylvania since.
Well, yeah, 2 cities with Alabama in between.
Right. 2 cities separated by 1950s Alabama. And it's just like, okay, like nothing about Philadelphia, nothing about Pennsylvania surprises me anymore at this point. Like
I live in that. I live right in the middle of the state, and it's so true. And you know what? Rite Aid headquarters is.
I mean, you could tell me that literally you all got lined up in a group and they drew numbers out of a lot and people were like volunteering as tribute in order to get vaccines, and nothing about Pennsylvania would surprise me anymore.
No, that's not Pennsylvania. What they would do is everyone would draw numbers. They would set up a grid on a football field and bring a cow onto it.
Yes!
And play cow pie bingo to see who gets that would be very Pennsylvania.
Yeah, you have to throw a football in there because they love their football.
It's actually funny. I think, on the tech side of it, I see Phil commented about minute clinics and flu shots. And honestly, I think from the tech side of it, this is where the tech is breaking. So, okay, what you get past, you're in Pennsylvania, you have 20 different places in a region to look for shots. So let's say you say, okay, seems like Walgreens and Rite Aid and CVS are starting to get shots. Let me try and pick one and go to Rite Aid and try and schedule. And it goes terribly. And if the reason you realize it's going terribly is these systems were all built for flu shots. Right. So there's plenty of supply. You log in and it says, give us your address. Let's see the closest place. And it lists the place, you pick it, and it says, okay, let's see what slots are available there. It's very straightforward. I pick a slot, I fill out my thing, I hit finish. When you're talking about a slot here and there is opening up once an hour in a 100-mile radius, it's not designed. So it's like, if you go here, you're like, okay, cool, let me click there. So, nope, there's none there. Nope, there's none there. There's websites like this VaxMax that have popped up to show you where there's potentially slots available. And this is where the problem's happening.
There's a 5-minute delay, okay? There's a 5-minute delay on this.
Mm-hmm. So if you happen to even get one that shows a spot, it'll say, okay, you're there, and then you grab it, and let's say you even happen to get it, then you fill out all the information, you get to the end and it says, sorry, someone else took that one. And the reason is because it's just not designed for high volume or high demand, low volume appointments.
I've got the scrolling circle of death. So this happens. This is new now with their latest update So I almost got an appointment here. That's my fear. I almost got something.
So if you look, this is one I started running into yesterday, and apparently what's happening here is they have an unauthenticated API endpoint which says, give me a store number and I'll tell you if there's slots available. And it says true or false. So if it's true, the site lets you go to this next page. Then it calls the API again with basically a CAPTCHA token, which then says, give me the actual slots that are there, an array of slots so I can show them here. It's getting back empty arrays, so the code just barfs. It's not constantly retrying, this will just not do anything. If you look at it, you'll see the JavaScript code errored out and it's just stuck here forever.
So when this happens, if you didn't know what Tyler knew, can you imagine your 75-year-old grandmother or grandfather trying to do this? They're going to sit here all day and go, why does that keep spinning?
Oh, and I just want to point out, this is not a mom and pop company. This is a billion dollar company that is publicly traded that doesn't have the ability to take an existing process and simply adapt it for different levels of variables. And at some point you ask yourself the question, this is awesome.
We're hitting every
real time
issue. Look, I got 12:15. Oh.
Well, also, this is the hilarious part. If you come in and let's say afternoon's picked, but the slot's actually in the morning, I'll say, not in this time slot. Because again, if you're booking flu vaccine, they have plenty of times available. When there's literally one time on one day, like there's all these extra steps, which it's just now a rat race of who can make the clicks fastest to get to the end to get the reservation.
Right. When
this is awesome.
we're
like I'm getting every issue that comes up that like when
we're having the same problems getting vaccines for people who need them that I'm having getting components to build a PC, everything is screwed up.
Even if you put aside hey, you're a giant billion-dollar pharmacy chain, you should be able to fix this pretty quickly and have a much better UX and all those things. What was crazy to me was there's another website called getmyvaccine.org, and they first started out with Walgreens, and Walgreens had a really open API. So you went to this website and you would put in your zip code, and it would list all of the actual time slots for all of the Walgreens within distance.
How long did it take for Walgreens to shut that down?
A day or two. So now they can just show you if there's a slot available or not. And then you have to do the same thing like with the other site. You click, and try and book it, and it disappears and all that other stuff. But what's crazy to me is even if you're not like, hey, you guys should be better at this.
Oh, I'm going to try Mechanics Pro.
There are companies who are good at like setting the parameters on very restricted things, right? So if we're saying, what are we doing here? We're trying to buy concert tickets that are going on sale, basically. Like,
right.
People, as much as you hate Ticketmaster, right? You know you're waiting in line. You know what order you're in. You know when the thing opens. You know if it aired out or not. Like you have some idea what's happening. Where these, it's all like tribal knowledge that's being passed around in Facebook groups because people don't know. Oh, the spinny thing means you got to restart. Right. You're not getting it. If you do this, try and fill this out first. Like there's all these little, which again are just limiting the people who can do this to people that have the resources, time, and energy, which generally means people more
like us,
more affluent. Yeah.
So I'll ask the question then, Tyler. If we could magically make any tech solution to this, what would it be? I mean, if there's $1 billion company that is struggling with it, and multiple, if we look at Rite Aid and CVS and all the, Walgreens and all the rest of them that are in there, like what is the answer here?
Well, I think first of all, I would disagree with we're struggling with it. The UX we are struggling with. They are not struggling with it. They have as many doses. Walgreens before this week they got they got 100,000 doses a week, and they were gone by Tuesday of each week for the most part, like fully scheduled. They weren't actually fully dispensed, but so they're getting their 100,000 times $30. There's no problem on there, and all their doses are getting used. So they don't see a problem with this, I would say. But to your point, if we actually wanted to fix this, I think what do most people want to know? They want to know, am I signed up? When am I eligible? Right? Like very basic thing. Like they shouldn't have to log in every day. So if you go into a system and you sign up and you say, okay, hey, we have all of your details, like your age, any conditions you have, and it says, hey, you're in group 1C. We estimate you're this, like, for example, Montgomery County in PA, the one county nearby, they have 2 vaccine clinics. They have an online sign up. They tell you, they've been doing it by date of sign up, where they're estimating, they say, hey, we're roughly getting about 1,000 vaccines done a day. This is the number of people signed up. If you signed up on this date, we're guessing you're 4 weeks out. And they send a once a week email update of like, here's how far we're getting, like here's what we're getting close to, and then you will get an email X number of days before when we're ready to schedule you and those types of things. And I think the average person, it shouldn't be let's make the click to try and get tickets easier. It should be you sign up and then we'll come tell you when you're ready to go.
Yeah.
So I'm at the CVS site, and I will say between Rite Aid and CVS has almost all their shit together. One, you don't get the crap of, oh, I see an appointment, but it's not available. No, you see an appointment, you click on it, you put your information, they hold it for 30 minutes. 30 minutes is a long time. For me it is, but for a senior, it's a perfect amount of time. So I'm going to give kudos to CVS for that. They legitimately thought this process out. But from getting your information in could be better. So I found a loophole, right? So if you look in all the states that are available, Pennsylvania, I can't get in. Delaware, can't get in. Oh, wait, Maryland. Ooh, there's some availability, but I don't live in Maryland. But I'm going to click schedule an appointment anyway. And I know my answer is no. Click in. That was just the intake screen. That's like the qualifier, right? Needed to start a vaccination. No, I'm not going to do that. Where do I want to be vaccinated? I have a choice because I've went through this several times. Basically, that intake screen is generic. That everybody gets that. I'm going to choose Pennsylvania. I can get in. So from the Maryland link, I was able to get into Pennsylvania now. And I am 68. Priority group, 65 and older. This is it for you, CVS. I like this process better than Rite Aid. Now, I just got to put in a zip code. Boom. Doesn't take me anywhere. So you don't need to go through the Pennsylvania link to get to the intake. It's just kind of the little loophole that you can get in. So technically, I could sit here and just do a refresh or just put a whole bunch of Pennsylvania zip codes in if I wanted to.
Do you know what the radius is on their zip code search?
I want to say 50 miles, but I pretty much have been just,
Like that you have all of the Pennsylvania zip codes memorized is terrifying.
Yeah. And I just click. And one thing I discovered yesterday was if I put a zip code in and the location I want is not available because there's only 6 in Pennsylvania on that day, if I click refresh, it changes the date for me. And eventually I get to a day that I want and I just have to pick the time. And that's what happened with my parents. So I wanted something today for them, which I did get. I just kept hitting refresh, and it would change the 2 locations that were close to me. But I was now I can bypass, well, not bypass, but their little link there. It says here, click here to schedule. Oh, this is a link, right? It's to get you to the intake screen. Now I'm in the actual scheduler. So, I didn't kind of tell everybody this, but yeah, once you get here, it's just a matter of hitting refresh. But of course, they haven't dropped any PA appointments since yesterday. So there's nothing out there, but I know they dropped Delaware. Now, if you live in Delaware or they live in PA, you can actually get from what I'm told, you can actually cross borders because Pennsylvania and Delaware are, depends where you live and where you work, but you could potentially go to Delaware and get a vaccine there as well. Same thing with Pennsylvania, New Jersey, I believe, too. You just have to have proof of it. But again, a little loophole, but the whole process with CVS, obviously there's been thought about this or they've really perfected, their system. But as you guys know, it's a little bit easier than the whole Rite Aid situation because Rite Aid just a whole nother. And I hate to bash on you guys, but put yourself in an 85-year-old grandmother's position. If your grandmother can't get through this without whipping you on the head with her shoe or a purse, you should we should make this simple for people. If you're going to get whacked in the head with your grandmother's purse, right, don't do it.
Well, and here's the bigger question, right? Like this is all coming into focus because we're worried about our parents and our grandparents, and we're trying to figure out when we're eligible for them and take care of people and that sort of thing. But it kind of highlights the issue. This process is used. I mean, when I see the New York process of go to this website and go through these 14 different steps, I'm guessing that's probably more or less the same process that people have to use every day to get healthcare in cities like that. And so you wonder, yes, we need to make it better for this, but is there a way to then push that out? Because your statement is true, not just for COVID vaccines, but I feel like is true for people who want to have some sort of say or involvement in their own healthcare anywhere. And I feel like if we're letting them down here, we're probably letting them down everywhere.
I worked in healthcare. I worked in the provider side and the insurance side, and it's a cluster, expressive word, on both ends. It really is. I know they're trying to make it more user friendly, but your average, person that's not tech savvy, I hear complaints all the time from family members. It is difficult to navigate through this, and I just don't understand. I don't understand why we've made this so difficult, even from an insurance level, or trying to get to a portal to create up a health account so you can, get your health records and then get your prescriptions. Like I do that for my parents, and my parents have no idea what I'm doing for them because they're like, oh, my doctor told me to set this up for me so I can, get my refills. And then I'm like, oh, set it up. And your mom needs to have her own email address. Well, she doesn't have an email address. She can barely text. Like the lady doesn't turn off the TV. She uses my dad's email. Well, she needs her own email address in order to get her own health portal account. Okay. So then, but I'm like, well, they can have one email account, but then your dad can be the custodian for her or the guardian. And I'm like, but we need an affidavit for that. And I'm just like, and I'm on the phone with the tech person going, do you understand? These are 70-year-old people and they've got one email address. My dad wants to see my mom's record. Actually, I want to see their records because I'm managing it. But you're telling me each of them have to have their own email addresses where they set up their account. I get it from a technical side, but from a functionality side, it's already gone over their heads. They've already walked out and go, I just want my pills. That's all they want. I just want my pills, or I just want my shot. Fix it for me.
One of I really like, there's a doctor, Dr. Aaron Carroll. He writes for the New York Times Upshot. He has a really good YouTube series called Healthcare Triage, like explaining, a lot of different healthcare stuff. It's really good. He did a whole series on like explaining each country's healthcare system, like how it works. Like here's how it works in France. Here's how it works in Hong Kong. Here's how it works in these different places. And I remember, he was being interviewed somewhere and they were talking about, and he said, the reason why there's not one best system is it depends what you're optimizing for, right? He said, like, for example, the UK is, the NHS is the most efficient system in the world as far as dollars to outcomes. Like that's their focus on. Will we pay for this type of treatment? Like how much does it cost? And how much, how much does it improve someone's life? How do we prove? Like it's all about outcomes to cost. And they all different ones focus on different things. I think France is very much like more focused on doctor-patient relationships, like maximizing those. That's why we get a lot of house calls in France. So the US is optimizes for profit. That's the only explanation. If you were going to wipe out the entire healthcare system and start from scratch, you would list a couple thousand other ways to set the system up than what we have here, because it's insanity on its face, the way we do things. And you see it in things like this. And then even just what I think is even more stark when it comes to things like this, where you're talking vaccines and people dying, is it's really easy for us as a society to figure out how to target resources away from certain groups of people. So then those people, have shorter lifespans, lower income, all those types of things. So when these type of situations come up where like, hey, these specific groups of people are dying, they're getting COVID more, they're dying from COVID more, we should probably focus our vaccine efforts there and treatments effort. And it's like, oh, you can't specifically call out this group, or when you're like, you're really good at drawing those lines, sort of. You can draw them basically the opposite way pretty easily, and and they'll be like, "Oh no, we can't do it that way." It's just sad to see. Yes, this is a microcosm, a sped up microcosm of what's the normal for healthcare.
Sure, and on multiple fronts, right? I mean, there's the kind of inherent bias against anything that is not largely white and male, which, I mean, obviously kind of permeates through that. But there's also this huge function of a long time lack of regulation and involvement of forces that are simply designed to generate profit. Like the way our health insurance system is set up was not a political decision. It was a decision that was completely put in place by the lobbying efforts of the people who were going to make the most money by the way it's set up. And so it's crazy that almost every time we have something like this where we trace that back, pick a thing that we're upset about with healthcare today, and we ask the 7 whys and we continue to get closer and closer to the truth, it almost always comes back to, well, we had to give that up in order to get this other thing that was good for people. We had to sacrifice people to the capitalism of the situation, of the system, in order to be able to protect these other people. And like when you say that out loud, you're like, in what universe do sane people knowingly look at, whether it's minorities or, like in Pumla's case, like people who don't speak great English, who live in multi-generational housing, or like people who have to work minimum wage jobs, like we make this decision that y'all get sacrificed to the gears of the economic system that we've chosen to let some people profit off of. And it always comes back to that. So all of these kind of huge systemic things that we want to fix, of which healthcare is one of many, it always comes back to, like, until the people who have taken out of that system the most for the last 200 years choose not to, it's really going to be difficult to figure out like how it is that we make any sort of meaningful impact on it.
So what you just said there just brought me back to Merrick Garland's statement. Was it Monday? Tuesday?
I think
when
Monday.
he was asked about why he was doing this and all that, and why am I helping seniors in my Asian community? Why am I getting up so early in the morning to help people that aren't my parents? One, because I want to help them. I want to do good. They don't have the resources to do this. And I feel like I have the skills, right? I know how to do this. And if I can help them extend their life, save their life, I'm going to do it. I feel that's the least I can do, because they're part of the village that helped raise me as a kid.
Sure.
And if that is the least I can do, God, and I'm not even helping them, but I'm helping non-Asians too. I've got a list of people that have been texting me that like, oh, we heard you got, some vaccine. Can you help? And I'm like, I'll put you on my list.
Well, and we get to work from home, and we have jobs that we're not necessarily worried about being significantly impacted. Like we have a lot of privilege beyond just our capacity for compassion that makes it so that we can have an impact if we choose to have an impact that not everybody can.
I feel like if we can do this to help others, we should be, because at the end of the week, I don't say we made this issue, but we as a society have sort of made it.
It's our issue, wherever it came from.
It is our issue, and we have to help each other. It's absolutely frustrating. I'll help anybody. I don't care what the color of your skin is. You could be purple. You need help, I will help you. So DM me if you live in PA and you need a vaccine. I will do the best that I can.
And the flip side is, I think we have, as people who work in tech, like we have the tools to have an even more outsized impact on this than someone who lives in Pennsylvania and who's happy to make phone calls and click refresh until they find an opening, right? I mean, again, it kind of goes back to that systemic side of things. Like we work at companies, or we have skill sets that can allow us to kind of, the folks who are putting up that website trying to scrape all those APIs and figuring out what they're doing, like I promise that didn't take them like 6 weeks and a product manager to figure out how to do, right? I mean, we have the ability to help with that. Sometimes it's just hard to figure out where to get started, or where you can go for resources, or what would have an impact, like what would be useful for the people who are struggling. It's always, worst case, you can always go back to just feet on the ground, ear on the phone, try to make stuff happen. But I feel like the tech part of it is where it gets interesting, because as much as we know that the tech can be part of the problem at times, I think it can also be part of the solution if we can figure out kind of how to harness that and point it in the right direction.
That is a great point. I feel like it's not the developer's fault, right? It's not. It's from the tech side. It's not their fault, but at the same time, the code can be written better. There's people like us could say, hey, because I'm sure there wasn't any real testing that went on. It seems like a lot of this was just thrown out, and I know Rite Aid and CVS, they're all doing upgrades. Every morning I'm seeing it. Their systems are being updated. They're finding these flaws, and I absolutely feel bad for the developers. I'm sure, and actually the infrastructure team, the people that are managing these servers. I'm sure they're probably like the CPUs on these machines are just probably going off the wall. So I feel for all of them.
Sure. Well, here's a question: how many?
Fault, but
back to Tyler's point of they don't see this as a problem. Do we really think CVS is throwing more resources at this?
No, nobody is.
Like, do we really think that?
Well, I think they kind of are. Like they're doing the minimum. I think why CVS might be a little better than Rite Aid is because if you've been to CVS Minute Clinic, they already had that stuff in place. Like if I had to book at a Minute Clinic or what, I forgot who, but it's always like, it seems like Minute Clinic, CVS and Walgreens are the places where, I go in when I need something, done with the nurse practitioner, in the back room or whatever. They have like the best,
there's just
website for it. So I think, and part of it is like, this is the problem that's going to disappear, right? So like, Biden ordered more vaccines at some point, like in April, we're going to have vaccines. And by the time my lazy ass, it's time for me to book my appointment, I'm just going to be able to just go and there's going to be plenty and that's going to be it. Right. Cause by the time we'll just have the numbers up by the time it comes to me, it's going to be all the, retired people that have to go through this scarcity. So I think that's certainly a big point. And I think another big point of it is the, these people are probably in a very waterfall kind of like mindset. They're not using CI/CD or whatever. So it's probably a Herculean effort to deploy every day for them. It's probably, even if they're using agile, they're using agile waterfall. They're using, 2 week, they're not sitting there and iterating and it's not in their budgeting and DNA, and it's not in their PM's mindset to adjust.
Well, because this is all going to be over.
We discovered that our net rate blows up. And it probably also doesn't help, but the teams over probably in India not here. They're not using the product. They're not, they're very insulated from those kind of talks.
Well, and when you're driven by profit, the question becomes, how sustainable is this? If we invest all of this money into changing the parameters of these searches because we do have constrained capacity and we do have geographical issues that we wouldn't normally have with flu shots, if we invest X amount of money in here, but we're getting paid, roughly the same amount for the COVID vaccines that we would get for every 2 flu shots anyway, is it even from a profit center standpoint, is it even worth making those investments? Or do you look at the news and say, well, the Johnson & Johnson's coming online and we bought a whole bunch of additional stuff, so let's just wait for the inventory to match something that works better with our process? I mean, and if you look at it from that standpoint, why would they? Right? Again, it gets back to optimizing for profit. If you're optimizing this for profit, what is you're not wasting vaccine. The vaccine that's been allocated and the vaccine that gets thawed gets used, and somebody's using them. And it really doesn't matter to CVS whether it's old people or young people or rich people. It doesn't matter to them. So why optimize that system if the profit that you're getting out of it isn't going to get increased?
Well, I mean, I would, if I was going to sell CVS in a capitalistic way, what I would say is if you did this, you get to generally move to a more JIT-based process. You get to be, more Elliott Goldratt,
Sure.
Moving your constraint, and here's your opportunity where you can possibly, take on, they're right now specialists pharmacies where they deal with the stuff that's generally refrigerated and the stuff that has to be hand muddled and stuff like that, beyond the basic, moxilin.
Right.
I would say, well, you're going to have to make this infrastructure anyway to do this. And then you can go compete with those little specialty guys and go
Right.
crush the specialty guy that just makes, the live diabetes medicine and the
and then CVS says we make $1 trillion a day off of all of our corporate deals to provide pharmacy services and prescriptions. And it would be cheaper for us to just get out of the vaccination business altogether than to invest that kind of money. Like that's the screwed up logic. And I don't know that any of that's true. I'm certainly not putting that on CVS or any of the rest of them. But when the logic is optimized for profit, then the people come absolutely last in the equation. Right. I mean, I question whether or not you can have that set of optimization and then make it so that it's a process that serves people at all.
Mm-hmm. Well, I mean, I think that I used to say to people, I had a customer. I've had Pool as a customer more than once, and one of the times in downtown Philly, I was meeting with someone before we were going to see a insurance provider, and they're like, I was saying like what a whole like crazy model it is the way we operate in this country. Like, I'm like, do you see that giant skyscraper? Like, it's filled with people that work for an insurance company, and their number one motive is to pay as few claims as possible. Like,
yes,
that's their motivation.
Like the beginning of The Incredibles. That's just the way it works.
So the model. That model obviously is being exposed. I think that's something just in general. The entire sort of COVID thing has exposed sort of the dirty underbelly of a lot of things I think some people knew but weren't really fully exposed to, of the way we do things. I talk to people that we have such nonsensical COVID requirements, restrictions by county, by state. They don't make any sense. And you're like, and then you understand why people that are a little like, oh, I don't know about this, they don't trust them. And you're like, yes, because they're nonsensical. Like, a gym can be open, but the park is closed. Like, and what, once you peel back to like, well, these businesses are going to go out of business if they stay closed too long because we're not going to help them. The only thing we can do is let
the problem there is not
again.
Right. The problem there is not that they're closed.
Yeah,
the problem is we're not helping them.
Shovel people into the furnace of capitalism. And to me, I do put some of that on. Like, I get it's like the mayor of Philadelphia or the council does not have the money to prop up every restaurant in the city for a year or two, and gym and things like that. It's got to come from the federal or state level. To me, the idea of like, well, we just have to play nice and say, no, the numbers are a little bit lower. If you're like, the numbers are still worse than they were when we weren't allowed to leave our house 10 months ago, but now you're opening movie theaters and gyms. Like, it doesn't make sense. And if they were just like, look, hey, this is what it is. These businesses are going to go under, but we can't get the money to help them. This is where we're at. Like, at least expose people to that truth. It's not that we're dumb or we're making bad, weird things or we don't understand COVID. It's like, we know exactly the transmission methodology, what's safe, what's not, but it's just like, got to keep the line going up and to the right. The stock market's got to go. So let's, throw some, it's the ultimate trolley problem. Yeah.
Yeah. And again, if you optimize for profit, the answer to the trolley problem is pretty apparent. Yes. It doesn't help the people that just got run over by the trolley, but that doesn't matter because we didn't optimize for the number of people who survived. Yep.
I think the good, like you mentioned earlier, good news. I saw something earlier that UPS is expecting, they're doing a lot of vaccine logistics shipping. They're expecting their shipments alone up 40% next week. You said we're very close to the J&J vaccine getting approved. Yep. So there we'll hopefully sooner than later we'll lose the vaccine dose supply constraint. We'll move that, down the Kanban board to the people able to stick the shot in your arm constraint. But that one's easier to fix.
Yeah, that one is, because you can train someone, and actually you probably could do two. Yeah, you could double fist it. Yeah, technically. If you really wanted to, but probably not a good idea.
And we have to, right? I mean, right now, as of the 24th, we're at 6% of Americans that are fully vaccinated. And at the current rate, by the end of April, that puts us at 27%. And that's just not enough. Like, great, 100 million doses in 100 days. Like, great, we can track it by state. But like, at some point, the only answer is that number has to be significantly higher. So I feel like it's not a bad it's not a bad strategy to focus on all of the blockers, right? I mean, we've got huge segments of the population who don't trust the government when it comes to healthcare at all, that need very targeted and special outreach to be able to do that. They also happen to be some of the communities who are hit hardest by it. So it's important that we figure that stuff out. We've got, healthcare folks who are quitting in droves because you just can't handle that trauma for that long and not be impacted by it. And then we've got the for-profit motive, which we're always going to have to find some way to work around in situations like this. I feel like and then in the larger picture, we've got the countries that are not the US to worry about as well. So, I mean, I feel like there are so many different things that we need to jump into there, that focusing on one of them just because that's the single blocker right now just means that we're constantly in this battle of figuring out what the blocker is and trying to overcome it, instead of looking at that whole system and saying, this group A, this is your challenge, and group B, this is your challenge, so that when the pipeline fills with doses that we can give out, we're not now scrambling to find out how to vaccinate huge parts of the country that don't have email addresses or don't have a Pumala to refresh the website for them 5,000 times an hour. Like there's a lot of blockers.
Yeah, I think this is where now having at least some amount of federal top-down approach, where I think in Philly Tuesday, FEMA's opening a mass vaccine site. You're starting to see a lot of let's get out of showing up to local CVS kind of situations and let's do things at larger scale. What's funny is I think Philly. Did any of you catch the Philly fighting COVID vaccine scandal story?
No.
No.
This is the microcosm of all of these problems we've talked about rolled into one. So the COVID starts, and this guy starts a nonprofit called Philly Fighting COVID. At the time, they were making masks. We're gonna sew masks. We're gonna do that kind of stuff. Cool. They get into doing testing. Hey, we can get access to testing supplies. We're setting up mass testing sites, and they're working with the city. It's started by I think Drexel college student, no medical background, not pre-med, anything like that. Decides to start this. So then now the vaccines are coming around, and Philly decides to choose this organization to deploy the vaccines. So you can imagine how this goes. They hand a bunch of college students, none of them with any medical training, a pile of vaccines. They set up a website, do all that kind of deal. They get volunteers. So now people are like, oh, we're vaccinating people. So you have healthcare workers volunteering on their downtime to vaccinate people. Hey, show up at the Philly Convention Center. Oh, you're a nurse, you're a doctor, you can do this, cool. They show up and they see college students giving each other the shots, all this kind of stuff like that. And they quietly change their status from nonprofit for profit once they realize they can get $30 a shot, and they get volunteers to do all the work for them, and then they can keep all the money. So obviously there was a lot of outrage about it. I think there was calls for the city health commissioner to resign over this. What makes it even worse and more of a microcosm is there's a group in Philly called the Black Doctors COVID Consortium, a group of Black doctors based in the city that were coordinating testing and doing all those types of things. And they approached the city about hey, we have doctors, we have nurses, we can do this. And the city went instead with some white college student to do that. So since then, they've turned it over to the consortium, and for example, they did a 24-hour vaccine clinic. Yeah. They picked all of the zip codes within the city that are the hardest hit by COVID. They did things that you would think would make sense. They ran these, people had to wait a while, but they did double. I think they got through 4,000 doses in 24 hours through the hardest hits parts of the city. So I mean, just the difference that you would say there's it all in a nutshell, right? Hey, someone's got a startup, some white kid's got a startup. Let's give them vaccine doses instead of these doctors sitting over here.
Yeah, and you put that in contrast with, we've had mass vaccination events before, right? We've had outbreaks before, and there are lots of things that don't track one-to-one between something that happened like in the late 1940s and something that happened in 2020. But that idea that, like the space shuttle, when you're flying something that has 400,000 moving parts built by the lowest bidder, like at some point you're going to get something wrong, and there are going to be people that pay the price for that. When you're bidding out the vaccination of your own citizens to any group, especially a non-professional one, like how did you think that was going to end? Like, how did anybody look at that and think, oh, no, they'll step up? Like, this is the equivalent of me selling T-shirts to my floor on the dorm and then having the school say, we need 50,000 of them to give out to every new student who visits campus. Like, it's not ever going to work. Like, nobody can ever scale that.
It's not even like, hey, you're already doing the T-shirt thing. We need 50,000 T-shirts. It's like, cool, you're doing the T-shirt thing. Can you make us the
brain surgery?
the Tyvek suits for our clean rooms for our testing. Like, yeah, sure, they're like T-shirts.
Yeah, I mean, we did what was I don't have the numbers in front of me, but New York City was something like 5 or 6 million people vaccinated in 2 weeks when they started detecting smallpox cases. Like, it's not impossible to do, and if you look back at it, we weren't running anything through local pharmacies. Like, that was the government would be at the state level or the federal level coming down and saying, here's how we're going to do this, and getting everybody on board to be able to do it. And that was not again, I'm not an expert and maybe I'm wrong, but it doesn't feel like that one was optimized for profit. And the outcome was very, very different than what we see now.
So do you think that was because it wasn't politicized as it is now?
Oh, New York City in the 40s, I guarantee it was politicized. To Tyler's point, I think it was just optimized for like people being terrified, and that vaccination was the way that you solve the problem. And
it's not the same now. People aren't terrified of COVID because you know what? It's just the flu. I got COVID. At least I didn't get the flu portion.
We've weaponized stupidity. Like, we have weaponized the stupidity of people and, in fact, actively encourage it because it helps with a specific political outcome. Like, that entire line of reasoning around it's just the flu, around it doesn't kill that many people, the idea that I'm more worried about me getting it than I'm worried about me being a carrier to give other, like, it is weaponized stupidity all the way down the line. And that's the part that technology wise, like, we can't fix that with code. Like, we can't fix that with an app. Like, that part of it, all the way down to,
stupid.
$10,000 monthly power bills in Texas. Like, when you optimize a solution for an outcome, you can't be surprised when you don't get a different outcome.
Yeah, I think if they've ever nailed down the originator of the quote is every system is perfectly designed to deliver the results it does.
Right. Like, when you look at the American healthcare system, it is working as planned. When you look at the American political system, it is working as designed. We can choose to change the design. We can choose to change what we prioritize for. We can put in the work to put those changes in place, but you can't be upset with the outcome that you get when it is designed and perfected over a significant amount of time to deliver that outcome.
Well, one of the things I think that's like, Pumla, to your point of like what's different now, also, I think one of it's at scale, right? So 1940s, I'm sure there was a ton of pharmacies in New York City, but the number of them that were owned by one person was probably a small handful. They own two or three locations. I think this is something that's like purposely culturally injected from the standpoint. The whole like vote with your wallet thing is nonsense, right? Like, think about any sort of thing you don't like. Oh, my internet sucks. I have Comcast. So, I'm going to switch to Verizon. Now Verizon's customer service is bad. Now I'm back to Comcast. Like, the idea of, CVS will want to make their experience great for COVID vaccines because if people don't like them, then they're going to start shopping at Walgreens. It's like, for some places where we live, they're populous enough. We have both. We have multiple. But plain people, we have Walmart. That's it. We have whatever. And I think you even saw that one of the biggest things, like I remember the first one was the Target breach, but then you go the Home Depot one or any of these really big PII hacks or credit card leaks. People are like, oh, you don't even see their stock dip anymore. Why? Because it doesn't change people's buying habits because they don't have a choice. The closest place to go get stuff is Home Depot. If Home Depot got all their credit card numbers lost the week before, like guess what? You're still going to Home Depot. So I think some of those things that people pretend are drivers for change in a naturally capitalistic environment just don't exist because why bother? It's CVS if they're or say Walgreens if their experience doing COVID vaccine scheduling sucks, like in the end it's not going to hurt them. So who cares? And from their perspective.
Yeah, no, I get it. I think a lot of people do. I think it's the frustration in all this. Just the whole. It's a year. Like today is exactly a year from when the CDC had their conference call, and actually somebody tweeted about saying, in the future we may have to make severe decisions, to contain this virus. And I look back and I think a year ago I was in Copenhagen, Denmark, with you, Jeremiah, and I was
at a Burger King doing significant damage.
Yes, and I was texting family like, this is going to get real. Like this is, they don't go on conference calls, public calls like this, and say, hey, prepare for something like this. Yep. And it's so many people tell me, "Oh, you're overreacting." I'm like, I don't know. I really, I don't know because one, you have a country that's already locked down millions of people. Something's not right there, and then you've got the CDC saying this, and next thing you know, the president saying it's all gonna go away in April. Yeah. I just feel like I think we're all exhausted mentally, physically.
And part of that Ignite tour that we were on, Pumla, looking back at it, we got a really interesting viewpoint on the beginning of that outbreak.
Yes.
Because I was in Beijing in December. I was in northern Italy in January. And then we did Prague and Copenhagen at the very end of February. And we're supposed to do Zurich and then a whole bunch of other stuff that were in there. And after Copenhagen,
I was shut down.
Yeah, I was spending a long weekend in London before going to Prague or going to Zurich, and they waved the flag and pulled everybody off the road. But we were 3 weeks ahead of the lockdown, my travel schedule was 3 weeks ahead of the lockdown in Beijing, and you could already tell people were talking about it there. And then we were less than 2 weeks before northern Italy just got completely shut down because of the outbreak that was there. And so it was, I had way more European context and Asian context on that issue before I ever got back to the US and kind of realized how much they were playing it down. So it was a really fascinating experience to, like you, be talking to people in the US going, like, this is no joke. Like they're closing down like entire multi-country regions and not just don't get on airplanes, but like don't leave your house, locking things down. And I'm hearing nothing about this, from home.
Oh yeah.
So it was very strange. It was normal, very surreal.
Yeah, it is. And I feel like it's been a year and I'm exhausted. Like I'm mentally
I'm too old to use. I'm too old to lose years of my life at this point, man.
I feel like I've aged 30 years. I miss people. I miss you, Jeremiah. Yeah. We would have had millions of burgers by now together.
Yes.
Eating Burger King around the world, right? I miss people. That physical connection you have, a handshake, just anything, and it is exhausting. And now I feel like the next month or two, I'm going to be. My parents have pimped me out to get vaccines for people, and I'm gladly doing it, but it's exhausting. And I know I'm not the only person. There's a whole Facebook group of people that are actually doing this for people, and it's amazing, right? We're helping others, but we shouldn't be doing this. We can be better. We really can.
And we need to Like I have to constantly remind myself that the biggest danger at this point is that people like me get frustrated with this whole thing and start worrying about me more than we worry about us.
Florida.
Right? Because look, I have a good job. I have a house that I haven't had to leave for, what are we on now? 357 days. Like, I mean, I recognize that the impact this has had on me is largely mental, not financial or health related. Like my kids are happy, my kids are healthy. I mean, I on the scale of who's been impacted, I'm way down at the bottom of that, and I recognize it. And every morning I wake up and hate this. And so I have to just constantly keep reminding myself that this could be way worse, that there are people out there who need help, who need encouragement, who need, somebody to tell them something funny to get them through the day, because like my sister is a doctor and she goes to a hospital in Washington, D.C. every day. She's a doctor of physical therapy, and she treats COVID patients all day, every day, because that's what they need her to do. Like there are people who have it way worse off than I do. And so I try every time I get frustrated, or every time I just want to throw up my hands and be like, I'm just going to go buy a house on the beach in Florida because they don't care, and we can all go to bars and it'll be fine. Like I just try to remind myself that, we'll get through this. It'll be stories that we tell, that our kids tell for the rest of their lives. But I just have to continue to be patient and as helpful and as optimistic as I can be, even when I look at the kitchen counter at 10 o'clock in the morning and go, there's no reason I couldn't start drinking. Like there's nobody to stop me. There's nobody to care, right? Like tomorrow is going to be the exact same as today. Like I just, reach out to the people around you, reach out to the people that you care about, whether it's over social media, whether it's text, whatever, like just reach out and make sure everybody's okay. Cause, those of us who have the privilege of not suffering as much as others, the least we can do is reach out and give everyone a hug long distance as many times as we can.
Final thoughts, Tyler, Justin, my neighbors.
I think I don't know if you guys have seen the same, but I think some of those frustration levels have increased, which seems counterintuitive because like things are getting better. But I think that's it. Late last year, there's no vaccine yet. It's like, this is our life for who knows how long. And they're saying, normally vaccines take years. I think once that first shot went in that first arm in the UK, we started on the path of, this won't be gone forever, right? We're going to be living with some version of this, but the path to normal keeps getting, the light's ahead, even if it's dim. And I think that's where the frustration goes of like, every day you can pull that closer is something that's, it's both, exciting. Like we're saying, the vaccines were increasing, we're Johnson & Johnson, everyone's ramping up, things are getting better, but it's still, I think the next month to 2 months will be some of the hardest since the beginning of like, we're really close. We're just not there yet. Where that frustration is going to be really high. And I think we said, you got to try and stick together in that time.
Jersey man, our neighbor across the river. Justin, yes. Final thought.
Yes, the river. Final thought. Well, my wife has both of hers.
Wait, did your cellular signal get better?
Yeah, a little better, little better. My mother-in-law gets hers on the 27th, so that's 2 days from now. She gets her first.
So you increase bandwidth.
Yes, we get increased bandwidth. Yes. So, yeah, I mean, I do see, and I do see how everything's like just different everywhere. Our schools. I feel really privileged. My kids are in, half day of school that goes remote sometimes when there are outbreaks, and my youngest one, she's in daycare. Because we get to do that, but there's the option of going full remote, and I do like, I don't know, I see so much disparity. I don't know what to do about that. I know we're not going to solve the tech issue because the tech issue will solve itself with production. So I don't know. I feel like we've just learned nothing, and a bunch of people died. 500,000 people, like we've 500,000 people died. We've learned nothing, and it could have been whatever 100,000 people instead if we were careful. But I don't know. We learned nothing.
Whew, on that high note.
Sorry.
He's not wrong though. Like, not the happiest ending, but probably the most realistic statement so far.
It is. We've learned nothing, but what we have learned is that we're humans and we all need connection in some way, shape, or form. I think you can all agree that we all need connection, and that's one of the reasons why I do these water coolers. Is one, it's fun, right? But we're also connecting in this world that we can't be physically near each other, and we can have these fun conversations, somewhat fun. But we get to vent out our frustrations and talk about ways how we can possibly make things better.
That's how you know it's terrible. My introvert friends hate this now. Like the people who for the first 3 months were like, this is fantastic. I don't want to talk to anybody. I like being in my house. I like wearing slippers all day. Like even they at this point are like, okay, haha, that was fun. Like I need some sort of interaction with adult humans here that is not inside my house. So when the introverts start asking to hang out with people, that it's gotten a little crazy.
Yeah, no, and I think I think we've all. I'm kind of an introvert, but like my first job as overnight tech support, you could tell like there was a limit to your introversion because like basically 8 a.m. the first sales guy would go in and I would sit there and talk to them next about sales for the week because I was that bored. Like still, like I don't care how much money we made. Like I'm gonna pay the same. But let me
just talk to me. Just talk to me for a little while.
Whatever. Looks like we're out of time. I know Tyler's got a meeting he's got to jump on to because he's got to pay the bills.
Attaboy.
Yeah, we all have to pay the bills, but thank you everybody for watching, and thank you Tyler, Jeremiah, and Justin for joining me. This has been so fun, and also it felt good to connect with everybody.
It did. Yes. You guys rock.
Yes. Have a great afternoon, all. See you guys later.
Bye, everybody.